So yes, we will be learning about the 30th chapter, hypertensive disorders of pregnancy. Hypertensive disorders of pregnancy constitute one of the leading causes of maternal and perinatal mortality worldwide. Globally, 42,000 deaths occur every year due to hypertensive disorders of pregnancy, which account for 14% of all maternal deaths. Besides maternal mortality, preeclampsia and eclampsia also cause significant maternal and perinatal morbidity worldwide. The National High Blood Pressure Education Program 2000 NHBPEP, that is High Blood Pressure Education Program 2000, classifies hypertensive diseases, complicated pregnancies into 5 types, which are as follows: gestational hypertension, also known as pregnancy induced hypertension; preeclampsia; eclampsia; chronic hypertension with superimposed preeclampsia. In 2018, the International Society for the Study of Hypertension in Pregnancy, ISSHP, introduced a new classification criteria for the diagnosis of hypertensive disorders of pregnancy. Gestational hypertension is defined as hypertension that develops for the first time in pregnancy after 20 weeks of gestation in the absence of proteinuria and without biochemical or hematological abnormalities. It is usually not accompanied by fetal growth restriction. Outcomes in pregnancies are complicated by gestational hypertension. Okay, yes. Are normally good. However, about 50% of women with gestational hypertension may progress to preeclampsia and have a poor outcome. The blood pressure returns to normal within 12 weeks postpartum, and hence the final diagnosis can only be made postpartum. Now here we have two tables: the classification and definitions of hypertensive disorders of pregnancy. Hypertension arising at or after 20 weeks of pregnancy. Gestational hypertension, where the BP is more than or equal to 140 by 90 mmHg, diagnosed after hypertension, 20 weeks of gestation without proteinuria, hematological or biochemical abnormalities. Preeclampsia is BP more than or equal to 140 per bar 90 mmHg, diagnosed after 20 weeks of gestation with proteinuria and or evidence of maternal organ or placental dysfunction. Other conditions: transient gestational hypertension. Hypertension known before pregnancy or diagnosed in first 20 weeks. Chronic hypertension, BP more than or equal to 140 bar 90 mmHg, diagnosed before pregnancy or in the first 20 weeks. Maybe essential hypertension or secondary to other causes such as renal conditions, vascular pathology, etc. Chronic hypertension with superimposed preeclampsia, worsening of blood pressure or new onset proteinuria, evidence of dysfunction of any one of the maternal organs consistent with preeclampsia in a woman with chronic hypertension. Other conditions: white coat hypertension, masked hypertension. Characteristics of gestational hypertension. Hypertension develops after 20 weeks of gestation, not accompanied by proteinuria. There are no biochemical or hematological abnormalities. Blood pressure returns to normal within 12 weeks postpartum. Final diagnosis is made only after 12 weeks postpartum. So gestational hypertension is not accompanied by proteinuria. There are no biochemical or hematological abnormalities. Blood pressure returns to normal within 12 weeks postpartum. Final diagnosis made only after 12 weeks postpartum. Gestational hypertension may evolve into preeclampsia. Okay. Let me continue the remaining part in the next video.